Everyone, I am Ravi Vasyal, fourth year MBBS from Universal College of Medical Science. Today I am going to present on ophthalmology student. Here we begin. Okay, you can see over here, this is Descemet retractor over here. It is folded at one end, you can see over here, and it is saddle shape. What are the use of Descemet retractor? It is used to retract the lids during examination of the eyeball in cases of Verism. Okay, it is also used in case of swelling ecchymosis. It is also used in removal of corneal foreign body, and it is also used for double eversion of upper eyelid to examine superior fornix. Okay, so you can see over here, this is Descemet retractor. It is folded at one end. Okay, let us begin forward. Now you can see over here, this is wire Rectus. Okay, this is wire Rectus. You can see over here. Okay, it is a wire attached to a metallic handle. Okay, so it is a wire handle to metallic. Okay, so wire attached to a metallic handle. This is wire Rectus. So what are the uses of wire Rectus? The uses of wire Rectus are: it is used to remove subluxated lens and anteriorly dislocated lens in intracapsular cataract extraction surgery. Okay, and is also used in nucleus in extracapsular cataract extraction surgery. Okay, so this is wire Rectus. Now let us move furthermore. Now you can see over here, this is superior rectus holding forceps. Okay, so you can see over here, this is superior rectus holding forceps, and you can see over there, okay, you can see over it is a tooth forceps. Okay, with S shape. Look, you can see over here, it is S shape. Okay, S shape, double bladed, curve near the tip. Okay, and it is double bladed, you can see in the image as well. Okay, and what are the uses of superior rectus holding forceps? Name itself suggests that. So there is rectus, so it is used to hold the superior rectus muscle while passing a bridle suture under it. Okay, it is also used to stabilize the eyeball during any operation such as cataract surgery. It is also used in glaucoma surgery, and it is also used in corneal surgery. Okay, moving further, now you can see over here, okay, this is Synsca Dialer or IOL dialer. Okay, intraocular lens dialer. So it is fine. Okay, it is fine but stout instrument with a bent tip. Okay, you can see over here, it is bent over here. The tip engages the dialing holes of the intraocular lens. Okay, so it engages the dialing holes of the intraocular lens. So what are the uses? Okay, so it is uses to dial PMMA non-foldable IOL for proper positioning in capsular back or ciliary sulcus. It can also be used to manipulate the nucleus in phacoemulsification. Okay, these are the uses of Synsca Dialer or IOL dialer. Okay, now let us move further. Now you can see over here, this is Martin's forceps. Okay, you can see over here, this is Martin forceps. Now moving further, you can see over here, this looks like a wire, so it is wire speculum. Okay, so it is wire speculum, and it is very light and causes minimal pressure on the eyeball, so it is also universal. So what are the uses of wire speculum? So uses of wire speculum are: it is used to keep the lids apart during intraocular operations such as cataract surgery, glaucoma surgery, and keratoplasty. Okay, it is also used in extraocular surgery, example skin surgery, pterygium surgery. It is also used in enucleation and evisceration operation. It is also used in removal of conjunctival and corneal foreign bodies. Okay, Collagen Clamp. Okay, over here you can see over here, this is Collagen Clamp. Okay, so you can note over here, and it consists of two limbs like a forceps which can be clamped with the help of a screw. The tip of one limb is flattened in the form of round discs, while the tip of other limb has a small circular limb. Okay, you can see over here, there is presence of a round disc, while tip of the other arms has a small circular limb. Actually, what is collagen? Okay, collagen is on chronic non-infective lipogranulomatosis inflammation of the mammalian gland. Okay, so a mammalian gland is present in the baseline of the above the baseline of the base of the eyelids. Okay, so we have to suspect that things. So if there is granulomatous things is going on, what happens? There will be painless swelling over there. Okay, painless nodules over there. So we have to catch that things. Okay, so to catch up that things, we have collagen clamp. Okay, it is used to fix the collagen achieve hemostasis during incision and curettage operation. You can see over here. Okay, it consists of two limbs like a forceps which can be clamped with the help of a screw. The tip of one limb is flattened in the form of round discs, while the tip of other arms has small circular rings. Okay, and it is used to fix the collagen and achieve hemostasis during incision and curettage operation. Moving further, now you can see over here what actually is this lens. Okay, and what is this lens? This is concave and convex lens. How we can identify either it is concave or convex? The most important feature for these things. Okay, so initially you have to hold the lens. Okay, when you hold the lens, then you can see, if there is this signs, you can represent this is convex, this is concave, but sometimes there might not be that things. Okay, so we have to identify by ourselves. So if there is concave, the image move with lens. Okay, so we have to catch in that hand and we have to look the image. If the image move with the lens, then we have to suspect it is concave, and it is thick at periphery and at thick center, and the image is converging. Okay, so that is concave. If the convex, in convex what happens, image moves against lens. Okay, so if you look through the lens, what happens, image moves against the lens, and it is thick at the center and thin at the periphery. Okay, so this is the most important things over here. Now you can see over here, this is universal metallic wire speculum. Okay, this is universal metallic wire speculum. It can be used in both eyes. Has two limbs and spring mechanism with a screw to adjust limbs. Its blades are open. Okay, moving further, now you can see over here there is presence of Zalaginisco. Okay, we have already discussed about the Zalagians. Okay, Zalagians, and this is sharp margin attached to a narrow angle. Okay, it is attached to a narrow angle. It is used to scoop out contents of Zalagian during incision and curettage. Okay, so its name is scoop, so it is used to scoop out contents of the Zalagian during incision and curettage. Furthermore, you can see over here, this is punctum dilator. Okay, punctum dilator, it has a cylindrical corrugated metal handle with a conical pointed tip. It is used to dilate the punctum and canalicus during syringing, probing, dacrocystography, DCT and DCAT procedure. Okay, now moving further, you can see over here, this is iris forceps. Okay, this is iris forceps over here. These are small and delicate forceps having fine one-tooth teeth on inner side of the limbs. Are used to catch the iris for the purpose of iridectomy during operation for cataract, glaucoma, optical iridectomy, and excision for iris prolapse, tumors, and entangle foreign bodies. Okay, so this is iris forceps, and it uses over here. You can see over here, it is used to catch the iris for the purpose of iridectomy during different surgery. Okay, and now you can see over here, this is lens expressor. What is this? This is lens expressor. It is used to express nucleus in extracapsular, okay, cataract extraction surgery, also using dislocated lens. And this is needle holder. Okay, you can see over here, this is needle holder, and this is iris depositor. Okay, you can see over here, there is two in. This is iris depositor. Okay, and it is used to deposit the iris anterior chamber in any intraocular surgery to break synsca at the pupillary margin. Okay, and with this I have completed my presentation on ophthalmology instrument. Okay, we'll be discussing furthermore. I will be coming back with another video. Thank you.